with you today and interacting with you a day when the world is focusing on the work of journalism and journalists as a whole. And I'm sure you are proud that South Africa is rated amongst the best in terms of media freedom, in terms of access. The fact that we are rated number 3 in Africa and I think number 31 in the world is a reason for celebration, especially on your side. This week, we commemorated the International Nurses Day, which we use to pay homage to the role that is played by nurses in the fight against COVID-19. Once again, we salute our valued nurses and we wish to assure them of our continued unwavering support as we continue to implement strategies to defeat the coronavirus. Equally, we extend our appreciation to health practitioners across the board for their continued involvement and efforts in waging the war against COVID-19. With regard to the issue of transmission from level 4 to level 3, we meet here at a time when we are preparing for a transition from level 4 to level 3 of the national lockdown as announced by President, His Excellency President Cyril Ramaphosa last week. Our focus today will be to unpack the latest trends and development with regard to this pandemic, but we will also share with you the KZN integrated response plan as we prepare to move to level 3. Just to refresh our memories, KwaZulu-Natal was the first to report a COVID-19 case in the country. Patient 0 was identified on the 5th of March 2020. Since then, the province's COVID-19 comprehensive response plan has sprung into action in a remarkable way. The province has seen a rise in the number of cases and deaths in the ensuing week, and we had to embark on an extraordinary measures to raise the awareness of our people about this disease. We hit the ground running in readying our staff and healthcare facilities to manage the situation. There was a period when the province reported a death rate of 2 people a day, and it led all provinces with regard to the number of deaths in the country. We can now report that there are days where we report no death at all. This makes us think and feel that we are making a positive impact with the programs we have put in place to fight COVID-19. In terms of assessing the impact of the lockdown, since the lockdown was announced and implemented, we saw the plateauing of the curve and then the steady decline in the number of new cases and the number of deaths. It must be remembered that we are a province that attracts more tourists. Hence, at the beginning, most of our cases were imported cases. We can attest to the fact that lockdown has worked for us in KwaZulu-Natal. We have been able to prevent a possible catastrophe in which thousands of people could have died. The lockdown has lowered the infection rate and provided us enough time to build capacity and the capability to mitigate the impact of this pandemic. In terms of the capacity created thus far, in just a few weeks or few months, KwaZulu-Natal has implemented a successful mass screening and testing program that has yielded positive results, and such results are as follows. 1, more than 2.4 million have been screened for COVID-19. More than 59,000 people have been tested. 1,498 confirmed positive cases. 806 recoveries. Now, if you look on that, the percentage is about 60% of recoveries. So it means that there is work that is being done. Sadly, we have lost 45 people as the province. With our bed occupancy in ICU sitting at 1.1 of the available ICU beds. The number of recoveries is increasing, and we're pleased to see this trend. We have managed to prepare more than 6,400 beds for isolation, quarantine, high care, and ICU throughout the province, with each and every district well represented in this regard. So our capacity to accommodate patients has increased, and I think we are now confident that we are not going to be overwhelmed by this pandemic. Last week, when we spoke here, we had 608 people who had recovered. We had 38 patients in private facilities and 64 in public. We had 40 deaths. This week, the number of recoveries stand at 806. Those recoveries give us hope that indeed COVID-19 can be defeated. That being said, we continue to see an incline in terms of positive cases, but it is comforting that the number of recoveries is also rising. We are working extremely hard to defeat and decrease the number of active cases. So each and every time we see, we would want to get active cases, more recoveries, so that we are able to defeat this pandemic. If you then juxtapose this against where we were in March, the bulk of the cases were in eThekwini and uMgungundlovu, meaning that the pandemic showed an urban-based profile. But subsequent to that, we saw Ilembe district overtaking uMgungundlovu. This speaks to the rising cases of local-to-local transmission. What is new today about this pandemic that we want to share with you is that the important trends compared to where we were 2 months ago. And that reflection is as follows. On the 16th May 2020, KwaZulu-Natal recorded 17 new cases. The province is currently, as of today, sitting at 10% in terms of active cases and has moved down to position 4 in terms of highest provinces in the country as a whole. While the majority of the new cases are still coming from eThekwini and Ilembe district, Ilembe district in a main has recorded more cases per 100,000 people infected if you consider the population size of that district. So the size of the district and the number of infections shows that there is more work to be done with regard to Ilembe district. A trend we are worried about, and we are working to stop this situation. While areas that were affected more were initially urban areas, we now note an increase in townships and still less of the increase in the rural areas. We need to work more to curb the spread in eThekwini, Ilembe, and uMgungundlovu. And these are to be closely monitored as we go forward. eThekwini has right now 866 of the province's positive cases, followed by Ilembe at 326 and Umgungundlovu at 64. We have a breakdown there that talks to each district, the new cases, the total patients, and as well as the deaths that we have seen in the province. So in terms of the new cases, I think we have reported about that we are now at, in terms of the total, 1,373. Now, while we report 45 deaths in the province, there was no death on the 16th of May. And why we are mentioning this is that we have been reporting deaths daily, and in some cases, the numbers will be 2 or more. We have noted that that cluster infections occurred in some workplaces, especially the retail shops, bakeries, companies, and healthcare settings. The recent one is a depot in eThekwini, where 39 cases were reported and 5 have recovered. 6 of the province's districts have not reported a new case for the past 15 days. So 6 districts have not reported any case in the past 15 days, and that is important for us. With regard to Inanda Community Healthcare Center, following the positive testing of 4 of our nurses, 4 nurses there in Inanda and 1 doctor, the department took a decision to close the facility. This was done as a safety precaution and to allow for the decontamination of the health facility in accordance with the established protocol. We have since tested all employees for COVID-19, and their results are being conveyed to them on a continuous basis. So far, there have been no new positive case from that facility. Employees who test negative will then be allowed to return to work after a period of quarantine. If any one of them test positive, they will not return to work until they test negative. In the interim, surrounding clinics have been alerted so that they accept patients from Inanda. To mitigate the impact of this situation and ensure continued healthcare service provision, we have roped in mobile clinics from KwaMashu as well as Tongat to service the community of Inanda. With regard to General Kizenga Mpanza Regional Hospital, this hospital will be opened from the 18th of May 2020. The hospital was temporarily closed following the positive testing of 9 mothers, 42 staff members and babies, as well as hospital staff. We wish to thank the people of Greater KwaDukuza for their patience and cooperation while this facility remained closed. We also extend our gratitude to the personnel who had to be deployed outside these facilities for serving the day and ensuring that our people continue having an access to primary health care services. With regard to the protective personal equipment, as the province of KwaZulu-Natal, we have adequate PPE stock at every facility, enough to cope with a demand for more than a month. At this stage, we can confirm that we have no shortage of PPE. As a province, we have put in place a highly effective mechanism to monitor stock available and ensure adequate replenishment thereof where necessary. With regard to the issue of the social relief of distress. Food security has been one of the central focus during this period of the lockdown. We have to date supported over thousands of vulnerable families with food relief program. We are also aware that the majority of our unemployed people in KwaZulu-Natal have applied for the unemployment support grant that will be made available for the next 6 months. With regard to preparing for level 3, the province is preparing itself for the level 3 lockdown as per the President's announcement that he is consulting upon. The level 3 means more business and more business sectors will be opened. There will be also the opening up of public transport, but that will require that we remain vigilant and focused and accountable. So all people, as we move to level 3, will still be expected to ensure that they adhere to precautionary measures that have been put in place. That will include social distancing, even in public transport. It will include washing of hands and sanitization and all of those, wearing of masks and all of those initiatives. There are strong indications that as KwaZulu-Natal, all our regions may move to level 3. However, there is a caveat for that to happen and remain that way. Everyone will have to comply with all the non-pharmaceutical approaches to prevent infections. So all our people will be expected to ensure that they all follow and comply with measures that will be put in place to ensure that we prevent infections. With regard to the approach of preventing the spread, the use of Operation Sukuma Sake, there are key guidelines and conditions that are in place. Everyone will need to wear a mask when venturing out in public. Our high-risk regions, in terms of our risk and vulnerable analysis, must be strongly examined before the end of May. Level 3 comes with a lot of movements, including inter-provincial travel. This means that our rural areas, where most of our elders live, may start to be exposed to the virus. As we prepare to ease the economy further, all businesses, government facilities, municipalities must have in place measures to prevent the spread of the virus and protect the people. The citizens, the business, civic society, government have to work together to ensure that we all adhere to the regulations. All businesses have to be sanitized. They must be proved that social distancing can occur in the place of work and in public. Sanitization and hand washing facilities for consumers and staff must be available. This week, we will inspect the readiness of all sectors to move to level 3. We will need to ensure and need to manage the hotspots together, and the whole of government, civil society, business need to work together as part of Operation Sukuma Sake, which we have integrated into the district development model. So our emphasis is that the district development model, when it comes to the district level, must be at the center of ensuring the link of all sectors. Business must not just demand opening. They must demand opening but put in place measures to prevent the spread. They must show us that indeed social distancing will be there. They must prove that people will be able to wash hands regularly. They must prove that there will be mechanism for sanitization. And in some cases, other companies, those that can avail public transport, that the companies that can transport their people, that will be also welcome because it is better, places the lives of the people more protected. And that's why we are saying moving to level 3 will need all sectors to ensure contribution. It's not a matter of saying let's go to level 3, then we move to level 3, then we work as if things are normal. At level 3, hotspots will be in a particular area, a particular ward, particular local municipality and district. The war rooms, task teams working will be, task teams will have to drive the behavior of our community. We must drive the behavioral change in communities. So people must know the manner in which we live and the manner in which we behave has to change. Contact tracing, screening, and positive and testing will have to be a focus of each and every place. And therefore, accountability and oversight will be a responsibility of all of us as we continue going forward. This target approach means our Sukuma Sake strategy and structures have to be functional from the ward level, the war rooms, and the district. The lowering of infection and our ability to manage outbreak, especially as more people will return to work, will be strictly monitored. Intensified screening and testing at every public facility, daily education and awareness campaigns, and the preparedness to manage all new cases that may arise will be key in determining the levels in the provincial district. We believe that the entire province should move to level 3, and that we should act fast if we see a district where there are concerning trends that emerges. So the whole of KwaZulu-Natal should move to level 3. But where there are concerning trends, we will have to intervene quickly. We urge everyone to play their part. It is in our hands to curb the spread of the virus through the change in our attitude and behavior. We must remind the people of KwaZulu-Natal that the fight against COVID-19 is for all of us. It is the responsibility of all to ensure that through our behavior and attitude, this war can be won. With that, we wish to thank you for your attendance.
Thank you very much, Honourable Premier. Colleagues, can we take the questions?